Welcome back at 8:18, and from football to soccer, even cheerleading, the fall sports season is well underway for students all across the region. And with the contact sports, of course, a lot of people are concerned about the potential risks of concussions, especially when kids can face them. Joining us now here on the Big Yellow Couch, Dr. Jennifer Kahner, emergency department doctors at Virginia Hospital Center, with what you need to know about concussions to keep your kids safe. And obviously, football is probably the first one, especially in American sports, that comes to mind. But as we mentioned, this can happen in soccer, heading the ball, head collisions, cheerleading from maybe a fall or something like that. Really, anywhere it can happen. How big of a problem is it in our society, concussions in kids, specifically in kids?
So in the emergency department, I see this several times a day, probably at least
a day.
Yeah.
Wow.
Yeah,
okay.
Right. Well, in the ER, that's usually the
Sure.
first place that they come. So maybe 4 to 5 cases a day when I'm working a shift, I'll see them.
Wow. So we hear the word concussion. I think we just kind of overlook exactly what it is. We know it's obviously an injury to the head, but what happens when someone is concussed?
So a concussion is a traumatic brain injury where the brain hits the skull. I think traditionally people think about it happening with a contact injury.
Sure.
I think a lot of people don't realize it can happen with acceleration, deceleration, or even rotational injuries. So if you think
Okay.
about a motor vehicle accident, so the head doesn't have to actually hit another object to be concussed. And basically what it is just kind of stretching of the neurons within the brain that can have some cognitive effects.
Because your brain really is floating, is that right? Is that in fluid in your skull?
Right, so there's fluid, the skull protects it, and then there is fluid that helps provide the nutrients and some protection as well.
Interesting. Symptoms or signs that parents can look for or people can look for in other people to know that they've suffered a concussion?
So concussion symptoms are going to vary from person to person and
Okay.
also severity. So there's mild, moderate, and severe. The most common would be headaches, vomiting, there can be dizziness, confusion. So parents may notice that a child having difficulty concentrating with their schoolwork or concentrating while they're at school. That could be a sign of it. There could be some amnesia, so loss of memory immediately before the event, after the event. Those are all very common. If
you think that you suffered a concussion or the parent thinks their child suffered a concussion, what should they do immediately, or how should they take action?
Anybody who, of all ages, feels that they have suffered from a concussion should always be evaluated by a physician. Multiple research studies have shown that people improve faster if they are evaluated and treated by a trained specialist. So they should always go to see their physician.
You mentioned emergency room is one of the places that people usually show up. Should you go to an emergency room? Should you call 911? Or should you make an appointment with your, family doctor?
That's a great question. So there are specific symptoms where you should go directly to the emergency department.
Okay. And
that would be any severe headache or a headache that starts and is getting progressively worse after the event.
Okay.
Vomiting. So if they vomit one time after an incident, that would be okay. But several or persistent episodes of vomiting would be concerning. Any neurologic symptoms, so numbness, tingling, weakness, unsteady gait, or slurred speech. If one pupil is larger than another, that would be very concerning.
Oh, okay.
Loss of consciousness. So if they have loss of consciousness with the injury or even several minutes after the injury. And severe drowsiness. So if somebody's very, very drowsy, difficult to stay awake.
Let me ask you this. Treating a concussion, whether it's in schools or, parents or anything like that, you break a wrist, you can have surgery or you can put a cast on it. You can't cast your brain or cast your head. What do you do? How do you treat a concussion?
So the only way to treat a concussion is rest, and so we say both mental and physical rest. Again, this is going to be guided by a physician, so they should always go to see their physician. It's really important to know that any screens can actually make symptoms worse. So that means TV, iPads, computers, phones, they overstimulate the brain and can make symptoms worse.
Okay.
So some students may have to take some time off of school or just kind of slowly ease back into it, and that would be guided by a physician.
Okay.
As far as sports go, they always need to be cleared before they return back to a sports activity, because you don't want to have a second head injury while
Sure.
they're still recovering from the first.
Okay, awesome. Dr. Jennifer Kahner, thank you so much for being here.
Yeah,
appreciate it. Veronica Johnson, over to you for a check on our weather, because there's going to be a lot of sports going on today as far as practices. It's going to be hot.
Yeah, and it's also going to be all about hydrating today.